Good afternoon, Mr. Anubhav Masih, Faculty of Ambedkar Institute of Higher Education, Teacher of Community Health Nursing. Thank you, sir, for giving us the opportunity to take an interview. Before starting the interview, would you like to tell few words about yourself?
As you know, my name is Anubhav Masih and I am a faculty and I teach here community health nursing in our college. I did my graduation from 2015 to 19 in basic nursing from JIPMER Institute. After that, I'm doing my postgraduate diploma in medical laws and ethics from National Law School of India, University Bangalore. And apart from that, I'm preparing for my nursing for the examinations.
Thank you, sir, for giving us an introduction. So, my first question, being the faculty of Ambedkar Institute of Higher Education, what are your roles and responsibility towards students?
First, in our institution, we try to make a person from a layman to a sensitive nurse and a sensitive human being. As we can see in today's world, we have seen in COVID times that a lot of people being non-sensitive also towards their patients, and they are not helpful as their profession wants to do that. But so our main roles and responsibility is to make a person sensitive, and a holistic development of the person should be there from our institution. That is our main goal.
Sir, how do you strategize the curriculum and how often it get updated to make benefit to the student?
So as it is our policy that we regularly updated ourselves from the evidence-based practice teachings and from the journals and latest latest research papers. We used to get ourselves updated and we try to give our students the same knowledge and same kind of awareness to the student what we used to get from our current trends.
Okay, sir. Sir, how do you help your student to cope up with the competition being so high outside world?
As you know, nowadays a lot of the exams are being conducted like AIMS or other central institute or other government exams. They are conducted on the basis of objective-based questions and the situation-based analysis. So we try to simulate those things into a classroom, and we used to give them after the subjects, after the particular topic, we used to give them the objective-based question, situation, after analysis-based the scenarios to the student to solve their problems. And in the same time, we used to provide them the skillful training into our labs, whatever the labs we have, like we have a fundamental lab, community lab, and the OBG lab. And the rest of the labs, we used to try to give them the adequate knowledge and as per the latest trends and the current knowledge.
So, what are the invention and approach you bring in apart from the curriculum to train the student?
So particularly, just because you are educated doesn't mean that you have full knowledge. So we try to give them the knowledge which is particularly which is going on in today's world, like whatever the situation being happen in the other parts of the world. Means like if a malaria happens in India, what is the difference of malaria in India and Southeast Asia? So we try to give them a broad idea for the comparison, like what kind of disease is impacting India and what impact it have on the people. On Indian people and on the other side of the people.
Okay. Sir, at last, I would like to know about your valuable feedback for the student for their prosperous future.
So as you have joined the nursing profession, as you know, it's a noble profession. Not everyone gets a chance to study this kind of course. So you being a privileged student to study into our college and particularly study this particular course. So you have an immense opportunity after graduating or after getting the certificate from our institution. So you can be a community health nurse, community health officers, or nursing practitioners in the foreign countries, or you can be a nursing officers at the central government hospitals or other state government hospitals. and you can be a nursing faculties by studying for further like MSc nursing and doing PhD in the nursing, and you can either go into the research fields by doing the PhD, or you can go further by doing the fellowships. So you have immense opportunity in this nursing field. It's not restrictive only to the clinical practices. You can go in either the village side, to the hospital side, or towards the clinical, to the teaching sides also.
Okay. So then, thank you, sir. Thank you for your valuable feedback and experiences. Thank you, sir.